Hello, my name's Sarah Whitaker and I'm a respiratory physiotherapist. This video will explain what might be causing or contributing towards your breathlessness and give you some techniques to help you manage your symptoms. Evidence suggests that how breathless you feel doesn't always match up that well with results of lung function tests or scans, or indeed with your oxygen levels. This is because it's not just lung function and oxygen levels that affect how breathless we feel. The way that we breathe, our thoughts and feelings about breathlessness, and how we go about our daily activities can all contribute towards our symptoms. You may hear this referred to as the breathing, thinking, functional model of breathlessness, which is a tool developed by the Cambridge Breathlessness Intervention Service to help people to understand and manage their symptoms. This video is going to concentrate mainly on the breathing area of that model. In each of these three areas, specific unhelpful behaviours or emotions can develop, which can prolong or worsen the feelings of breathlessness. Being breathless can sometimes lead to the development of an inefficient breathing pattern. When we feel breathless, we might feel as though we're not getting enough air, so we take deeper breaths or breathe faster. This means we don't always take the time to fully breathe out, or we can't fully breathe out. This can lead to the breaths stacking on top of each other, especially if we don't take the time to fully breathe out. This can mean we start using the top of our chest to breathe more than using our whole lungs and breathing into our tummy. Breathing from the top of our chest is much harder work. This can lead to us feeling more tired and actually increase our breathlessness. Breathing control is a useful exercise to practice to make sure that you're not using unnecessary energy when you're breathing. It can be really helpful, particularly after exercise or when you're feeling anxious. Breathing control means breathing gently, using the least amount of effort. It makes the best use of your diaphragm, which is your main breathing muscle, which sits just underneath your lungs. As the diaphragm contracts and flattens, it creates more space within the rib cage, which reduces the air pressure and draws the air in. As the diaphragm relaxes, it domes back up and the air flows gently out. To see if you're using your diaphragm well, try sitting in a chair and resting one hand on your upper chest and one hand on your tummy. Try to relax and make sure you're not holding any tension around your hips or your shoulders or your neck. Let your shoulders drop away from your ears and gently move your head from side to side to release the neck. Breathe in and out through your nose if possible. Sometimes closing your eyes can help. As you breathe in slowly, imagine you are filling a small balloon in your stomach. You should feel most of the movement at your lower hand with very little movement of the upper chest. Try to use as little effort as possible and make your breath slow, relaxed and smooth. If you find it difficult to feel, you could try sitting in front of a mirror so that you can watch what's happening. You can further improve your breathing by making sure that your breath out takes longer than your breath in. It can be useful to sometimes think of a rectangle. You can often see one nearby, like a picture frame or a window, for instance. Follow the edges of the rectangle with your eyes, moving slowly around each side. As you breathe in, allow your eyes to travel up the short edge, and as you breathe out, travel along the long edge. This will encourage you to breathe out for a little bit longer. Gradually slow the speed at which your eyes move around the edge of the rectangle. You can use breathing control combined with other breathing techniques to help you manage your breathlessness. Some of these techniques work better for some people than for others, so it's worth giving them all a try and seeing which works best for you. Pursed lip breathing can be used at any time to help you control your breathing. It helps to empty all the air out of the lungs, so it's particularly useful for people with chronic obstructive pulmonary disease, where the narrowed airways can trap air inside the lungs. Breathe in gently through the nose, then purse your lips together as if you were trying to blow out a candle. Blow out with your lips in this position, just for as long as feels comfortable. You don't need to force it. Blow as you go can also be used to help make activities and tasks easier if you use it whilst you're doing something that makes you breathless. It can be used along with pursed lip breathing. Breathe in before you make the effort, and breathe out as you are making the effort. For instance, if you are standing from a chair, breathe in before you stand up and breathe out as you stand up. Paced breathing is useful when you are doing something active, particularly something rhythmical like climbing the stairs or walking. You try to pace your breathing with your steps, and it can be used with blow as you go and pursed lip breathing at the same time. Count to yourself as you walk or move, perhaps breathing in for 2 steps and out for 3 steps. But you can experiment with the timing to find something that feels comfortable for you. Getting yourself into a supported position can also help you to recover when you're breathless. You might find you already do this without thinking, leaning back against a wall, for instance, or leaning forward over the back of a chair or a windowsill. If you are particularly breathless, perhaps during an exacerbation or flare-up of your condition, you could try supporting yourself on pillows, either when sitting in a chair or laid on your side in bed. It is worth remembering that breathlessness will generally recover. Sometimes just talking it through to yourself can help. I've had this feeling before, I know it will go away, I'm going to lean forward and practice my tummy breathing. I can do this, I am okay. Another thing that can be really useful is fan therapy. Having a fan positioned approximately 6 inches away from the face, blowing over the central part of the face, can help to reduce breathlessness. It is thought that when the face is cooled, it stimulates the trigeminal nerve, prompting the body to reduce the heart rate and the breathing rate. You could try this after activities that make you feel more breathless to help to speed up your recovery, and it can be used as often as needed. You can get small handheld fans to take out with you, and you can even get rechargeable fans that sit around your neck. How you think and feel about your breathing is important. It is natural to feel a sense of anxiety or panic when breathless, so experiencing worrying thoughts and feeling anxious when you have a long-term lung condition is common. Our breathing pattern changes according to our emotional state. When we feel anxious, we tend to hold more tension around our neck and shoulders, which can lead to us using that more inefficient upper chest breathing pattern. Learning to relax or doing activities that you find calming can help you to manage your anxiety and reduce the breathlessness. If you feel you need additional support to manage anxiety, it is important that you speak to a healthcare professional to see what help might be available for you. Lifestyle factors can also influence how breathless you feel. Your fitness level, muscle strength, body weight and posture can all contribute to an increase in symptoms. Because breathlessness is an unpleasant sensation, it is natural to try and avoid it by reducing our activity levels and avoiding the activities that make us feel breathless. However, this leads to the muscles involved in moving and breathing becoming weaker. The weakened muscles use oxygen less efficiently and are not able to do their job as well, which makes the breathlessness worse. Often, family and carers try to help by doing things that we might otherwise have done, and this further reduces our activity. It can help to understand that getting moderately breathless by being active is not harmful and can actually improve breathlessness over the longer term. Joining in with supervised exercise, such as pulmonary rehabilitation, can give people more confidence to do more on their own. Physiotherapists can advise on the best exercises to improve your strength, fitness and posture. Sometimes aids and adaptations around the house can be helpful to promote independence and reduce the amount of energy that you're using during everyday tasks. An occupational therapist can talk to you about what might be suitable. By recognising and addressing symptoms in those 3 areas of breathing, thinking and functioning, you can feel more in control of your breathlessness. Thank you for watching this video. The information provided is to help people to manage stable, long-term breathlessness. If you have any questions or concerns about breathlessness, or if you feel that your symptoms are getting worse, it is important to seek medical advice.